In despair, doctors have to do a heart bypass to bleed back to his brain, as well as other organs, to try to save his life. So what happened to him? Mr. B, 34 years old. You're a good dancer. I also love my job. But one day he had pain in his crotch and calf. With a dancer, the frequent suffering of muscle pain, tired is normal. I think so. However, 7 days later, you're hospitalized in an emergency. Then there's clinical death. In despair, doctors have to do a heart bypass to bleed back to his brain, as well as other organs, to try to save his life. So what happened to him? Angina pain, and the left calf is different this time. The pain does not subside and goes away, but it's growing. It's only the left leg that makes you very nervous. However, I haven't decided where to go for a medical exam. A week later, Mr. B's leg began to be swollen, tense, and painful. At 17:30 on Saturday, Mr. B began to feel short of breath, feeling short of breath even when resting. He fainted twice and then woke up. But you don't have seizures, no paralysis, and very fast breathing. You can immediately into the emergency department. Mr. B is awake but has low blood pressure, 100 per 60 millimeters mercury. Difficulty breathing, rapid breathing rate 24 times per minute. It shows that your body is lacking oxygen. Mr. B is having trouble breathing. You're breathing oxygen. Then you have to turn on the oxygen mask. Blood pressure is getting lower. There's only 80 per 40 millimeters of mercury left. Respiratory and circulatory disorders. Very fast. The doctors immediately noticed the severe danger to your life. So what's your problem? Mr. B has difficulty breathing and has low blood pressure. Difficulty breathing may be due to heart disease. Imagine the heart. It's like an energy capacitor in front of Iron Man's chest. It provides oxygen energy to the whole body. When the problem occurs, heart function is impaired. Your body will lack oxygen and have trouble breathing. Acute problems can happen to Mr. B. Could be acute heart failure, myocardial infarction, heart arrhythmia. Maybe Mr. B has difficulty breathing due to the lungs. The next object we suspect. Of course, it's the lungs. Is there something wrong with Mr. B's breathing? Is there an airway blockage? Does Mr. B have asthma, cough, have pulmonary edema or pulmonary embolism, pneumonia? Or one final cause is muscle weakness. Mr. B has low blood pressure, so blood pressure drops. It can occur in all types of shock, including hard shock distribution disorder, including septic shock, anaphylaxis, shock volume reduction, blood shock loss, occlusion due to pulmonary embolism, and so on. There's too many risks. There are so many pathological problems that can be thought Summary of acute heart disease. The lungs are the leading suspected cause, and assessment measures were put in place immediately. Immediately, Mr. B gets a heart ultrasound. The results show that the heart chambers increased pulmonary artery pressure. The left ventricle has more muscle, so it's the biggest part of the heart, as well as performing the most functions. But your heart function is currently abnormal. His heart is deforming. This is combined with a swollen left leg. Long-term bruising has warned doctors that he's suffering from acute pulmonary embolism. Pulmonary artery impact, the blood caused by the pulmonary causing blockage of blood from the ventricles. You can't move. It causes the heart to deform. It doesn't work, leading to organs failing to function due to lack of oxygen, especially the brain. When the heart stops without oxygen, death is near. This condition is acute. He doesn't have any heart disease. The lungs before that, except bruises and feet that he subjectively doesn't notice. Blood clots that form from venous blood stasis. And for some reason, Mr. B's blood has accumulated. Normal low blood pressure because in the veins. There's no mechanism to pump venous blood will passively return to the heart only. However, the blood, it'll make the blood stick together, formed with blood clots. It's called deep vein thrombosis. When a blood clot forms, release and go directly to the blood flow. Normal. The blood clot stuck right in Mr. B's pulmonary artery. The right heart is smaller than the left. Because the heart has to deliver blood to the lungs doesn't need high pressure. Because the lungs need to be close to 10. But when the pulmonary artery gets clogged, the heart must be enlarged by blood stasis. Pressure on the heart increases. It's pressed against the interventricular wall back into the left ventricle to occupy and reduce cardiac output. That's why his blood pressure is getting lower. And the blood doesn't pump to other organs in the body. The cells are screaming for oxygen. It causes shortness of breath. The organs in Mr. B's body begin slowly dying away. The test results are becoming more and more positive. Of doctors. Ultrasonic heart shows poor motor function. It seems that the heart is not failing, but the right ventricle dilates and the pulmonary pressure increases. The hypertonic structures in the right atrium are highly mobile. Then the diastole shows suspicion. This is a blood clot. Electrocardiogram at S1Q3 The presence of S waves at D1 and Q waves at D3 wave greater than 0.55 accompanied by T wave inversion at D3. Here's a specific ECG image. The coordination artery action. Dimmer 10,497 Ng per milliliter increased. Dimmer is the product. It occurs when the body tries to melt. Increased dimmer blood clot. That there was a blood clot in Mr. B's body. The body is also trying to get rid of it. The situation is getting worse. Mr. B has difficulty breathing SpO to 85%. He has to breathe oxygen from 80 out of 50 and below. You're all intubated. Then the circulatory arrest appears. However, this only happens in a few minutes. There's still a chance to save his life. An emergency immediately between leading professors and experts in the field. So, there's no way to get the blood clot out of his lungs. There is no, but it has to be done immediately. Because he's dying. It's not practical to remove a blood clot through open surgery. It's a matter of time. To use laparoscope surgery, catheter across the bloodline, it's also not possible to pump fibrinolytics for reasons as above. The fastest solution. It's a fibrinolytic infusion. It was also his last hope. The doctors decided taking low-dose fibrinolytic drugs, 0.6 milligrams per 1 kilogram, medicine blood fiber and the anticoagulant will dissolve the clot. And it's the main cause of disease. When solving the problems, AB can be reversed. The doctors just gave him a fibrinolytic. He just revived his heart until he wakes up or death. Time is still ticking. The heart is back. I hope to be back with Mr. B. Then Mr. B's hemodynamics improved. You're cut off after a day, and tracheotomy after 2 days. So there's still a question to ask. And still unanswered. Why does Mr. B have an artery when under? And that leads to the pulmonary artery. What's the original cause? Doctors are also very ask about this problem and find the cause. His lab tests include antithrombin B8 increased to 95%. Protein C8 for percent, protein S 1%. This indicates that Mr. B is suffering from hypercoagulation. Mr. B is a person whose blood is easier to clot than others. This is explained. All Mr. B will be prone to blood clots than others. You're required to use anticoagulants for the rest of your life. So, I hope you are always careful with your health. Periodic medical examination. Be careful with the swelling. Bruise one leg as well as any. Something unusual happens in my body. I wish you all the best.